Upon entering the room, I would wash my hands, introduce myself to the patient. Hi, my name is Olivia Benitez, and I'm a nursing major at Cedarville University. Today, I am going to be administering and discontinuing an IV. It should only take me about 5 to 10 minutes. If you have any questions throughout the process, please feel free to ask me. Can you please confirm for me your name and date of birth? And they would do that for me, and then I would check it with the doctor's orders just to make sure it's in the right room, the right patient, doing the right procedure. And then I would provide privacy for the patient. Just make sure that everything is set up, all my supplies are gathered, and the bed is locked. And then I would start. So I'm just going to put together the saline and hub and stuff like that. Scrub the hub. I would flush the tube to make sure that I got all the bubbles out and set it aside. I'm going to look for my IV site and apply the tourniquet. Grab my chlorhexidine and clean the site. While that is air drying, I'm going to apply my gloves. And I'm just going to tell my patient that they're going to feel a slight pinch. It'll only hurt for a couple seconds, and then they will be good to go. Apply pressure. It and saline, and then I'm going to release the tourniquet. I am going to flush this to make sure that I am in the vein, and then I'm going to take my gloves off. And apply the bandage. And then I would also tape this to the patient's hand, making sure that it is secure. I would date, initial, and time the tourniquet, or the bandage, and then I would leave the room. But before I would leave, I'd make sure that the patient didn't need anything, that they could reach their call light, ask if there's anything else I can do before I leave, make sure the brake was on, and then I would leave. And then I'd come back later when I was to discontinue, and I would introduce myself again. I would wash my hands before that though, and just say, hi, my name is Olivia Benitez, and I'm a nursing major at Cedarville University. Today I am going to be discontinuing your IV, so this should be very quick and easy. It should only take a couple of seconds. If you have any questions, just feel free to ask me. I would make sure to provide some privacy and make sure the bed was locked. I would take the tape off. This wouldn't be on there. And then apply my gloves, a new, fresh pair of gloves. Grab a 2x2, put a little bit of pressure on there, but not too much. Pull this out and check for intactness. Apply pressure for 2 to 3 minutes. Put a bandage on, and then I would document all of my information, the fact that I took this out, and then I would ask if there's anything else I could do for the patient, give them their call light, make sure that the brake on their bed was on, and just make sure my patient was comfortable. And that's it.